appreciate the opportunity to be here today. Um, as Amanda mentioned, is the title of my talk is really kind of reflecting a little bit on the past few months, and then we'll focus then on things going forward here as we get into it. But so experiences in COVID-19 diagnostics and their direct application in the U.S. pork industry. And so basically is since the middle of March, the folks at the lab here in our group has really been immersed in the COVID-19 response and helping support and expand testing capacities here in the state of Iowa. Just a little bit of a timeline of kind of what that's looked like for us here was that we kind of got engaged or involved. It was that third week in March and really just started on a conference call that we had set up with the State Hygienic Laboratory over at Iowa City. And that was on a Thursday afternoon. I think it was about 3 or 4 o'clock. And then by the next day, we had a number of our equipment and reagents and supplies and so on that we would commonly use in our high throughput molecular diagnostic workflow here at the laboratory, and had them loaded up and moved them over to Iowa City. And by that was on a Friday morning, and then by the next day noon, they had that equipment and reagents and system up and validated in their system there at the hygienic lab, and that's was kind of our entry. And then within the following month, we had a faculty member here, Dr. Karen Harmon, was able to develop a single well PCR because the assay that had been approved at the time that was originally rolled out by CDC recommended was actually it took three different PCRs to get a result, and so this was a huge step by getting that down to one assay, one test, as well as it was also works in half the time. And then as we got into the third week in April, and we were back and forth continuing, and we had continued to transfer some more equipment over that month. And as we got into the third week, it was kind of like, well, what else can we do to help our colleagues in testing in Iowa? And at that time, it was really a joint decision between the University of Iowa and the Hygienic Lab and Iowa State and our diagnostic lab here to proceed with developing a human patient client laboratory service here at the diagnostic lab that we call Public Health Testing Services. And so then in May, we proceeded to basically get in that initial stuff that was looking forward to say, what else can we do? There was a thought at the time that there's going to be a significant need for antibody testing as this thing goes forward, and with SHL being pretty much tapped out as far as focused on the PCR testing, that maybe our primary role going into it should be to support the antibody testing. And so we proceeded to get certified to do that work. And then also a monumental effort was to create a customized version of our laboratory information management system and client portal to be modified to fit this human patient client use case and be in compliance with all the HIPAA associated information security things. And so we got that moving forward, and then we retrofitted and populated a lab space here at VetMed to help support this effort. And then in the middle of June, we had those things done and onboarded and beta tested and so on. And then we launched what we call this PHTS, or Public Health Testing Services. And again, with the intent going into it, was primary impact on high throughput serology. And then also in June, it became clear that there was some local needs on the PCR that were not being met for sure. And so we went ahead and got certified to do that work, and have since been supporting some local use cases over the past month. And so just a picture of the website and our portal and all that. And for those of you who may be users of the veterinary diagnostic lab services or through the portal and so on, you'll see probably a lot of similarities in the look and feel how it works. And so our current role is to provide be the source for as interest and may grow for high throughput antibody testing services, which we believe will happen as we get further into the outbreak. That we're to be the center or resource for that for all Iowa healthcare providers. And this was done through an agreement between, I should say this, is the state of Iowa, the governor's office really, with great support from that group, and the University of Iowa, the State Hygienic Lab, Iowa State University, and then our team, obviously here, the Diagnostic Lab. So to serve as that as a resource for Iowans, and then to onboard the PCR testing, which has really been as we people know, is that's really been the core of the testing. That's been the current demand. Yes or no, am I shedding or not, and if so, maybe how much? And so we brought that on, and currently, basically, we're serving ISU-based entities, and then some local healthcare providers for what they call some qualifying, meaning those are tests that could be done or would otherwise be provided by the State Hygienic Lab. And so we're doing that for some local health providers. And we're currently in the process of working through some opportunities and some hurdles, some legal things right now to get to have the ability to really, I think that would really greatly expand our scope of service for both of these, and most certainly in the near term for the PCR. And the other thing I would want to mention, and I think it definitely will come back in just a minute, but part of our thing when we went to set this up, a real key thing as it talks about, and Jamie mentioned it in her talk about, preparedness, connectivity of information and traceability is a big thing. Not only in the animal space but in the human health space as well. And so one of the core things here, because this was a really big effort to get our an IT system set up for the human patient use case in pretty short order, and being able to receive the information electronically directly from the human healthcare providers. But it was identified early on in our discussion with our colleagues and friends now at the hygienic lab that is a huge thing and a core need, and because we would probably prefer to say, could we use their system, things like that. But the issue was we found, major constraint there is in the way the system is working with what they have was it takes is the entry of the patient level information into the system. So entering all the patient level demographic information into the laboratory information management system, and to the tune of it takes 6 minutes per case. And in the human space, each individual sample is its own case. Okay, so you start doing the math on that. That's about 12 samples an hour per case entry technician. Okay, so that's a huge bottleneck. And so because we were clued into that is really why we went down this path to say we really need to develop our own system to be able to receive the information directly from the human healthcare providers electronically if we're going to play any sort of scalable role in this thing. The other thing that I wanted to make very well mention is here of all the kind of hardship and crisis that I know everybody on the call has been going through and so on, and our kind of the flurry of activity here at the lab around this is probably, I would say, by far the bright spot. Has been really a rewarding thing of meeting a guy named Dr. Mike Pentella, who's the professor and director of the lab at Iowa City. And this group has just been, I can't say enough about, just super tremendous to work with, extraordinarily helpful both ways. And just wanted to give those acknowledgments where that's due. And I can tell you is this synergy amongst our groups is probably somewhat unique in the country. And so I think it just speaks so well of Dr. Pentella and maybe Iowans in general, but really appreciate Mike's support. But kind of our lessons as we've gone through this and kind of in partnership with this crowd, you talk about, what are core elements of emerging disease preparedness, at a public health lab system. As you go down through here, you talk about competent personnel, robust lab systems, having validated assays and multiple options and vendors available, high throughput testing platforms, the need for user-friendly and effective sample types, connectivity of incoming lab submission information in such a way that you can get complete and precisely correct patient level information, the ability to message these things electronically on the back end, automatically to keep very capable epidemiological tools for tracking, tracing, and containment, and really the requirement for certain of all parties pulling in the same direction across public and private-public partnerships amongst individuals, industries, institutions, and partners in government at both the local, state, and federal level. And when you look at this here, okay, this is kind of the lessons that we've been going through with this experience. And then I pulled up a slide basically from a talk I had given back in 2015, and this was to the American Association of Veterinary Laboratory Diagnosticians and the U.S. Animal Health Association. And it was speaking to kind of lessons learned from a diagnostic lab setting from our experiences of helping, Iowa poultry producers respond during the HiPath AI event of 2015. And basically the take-home messages from that were pretty much the same that we've said that we had identified from going through the PDV experience, okay, from what are the needs at a diagnostic lab to be able to respond to emerging in a scalable way to emerging diseases of significance. And if you look at this list, personnel, systems, assays, multiple options, high throughput testing platforms, user-friendly and effective sample types, connectivity of information. We tend to talk about sites more than individual patients. Automated mass messaging to capable epi tools, and truly working industry, state, and federal partnerships. You see kind of a lot of similarities between these two things. And so kind of the take home from that has been that, definitions of maybe preparedness in a diagnostic lab environment I have the good fortune to work within is kind of our take-home message is that really the preparedness are the systems and infrastructure and practices that are being used daily. And maybe proficient response is the ramping up of such systems, infrastructure, and practices that are being used daily. And that such preparedness really, I don't think, at least our experience has been, you can't be proficiently planned or developed in the midst of the crisis. You just can't make this stuff up on the fly, in our experience. And so some of those experiences were key to influencers, I guess I would say, in the thought process to a group of colleagues here at the College of Vet Med at Iowa State that led our team here, Dr. Zimmerman Roth, Carrie Larson, and Pam Zabel and I, to put forth a proposal in June of 2018 that was entitled a case study. It was entitled a case study to conduct a proposal to conduct a case study entitled "Is it time for an NPIP-like program for the U.S. pork industry?" And so this was a proposal put forth to the board of the Swine Health Information Management Center in June of 2018 and was funded to conduct this 12-month study. And if you have any interest in the study, afterwards, all of the information about the study, the findings, ways to digest it, are available at this URL of U.S. Swine Health Improvement Plan.com. And so kind of the things from that study was we We did the study started in the summer of 2018 by attending their what they call the NPIP, or National Poultry Improvement Plan, what they call their biannual meeting or biannual conference. I'll talk about that in a little bit. But kicked it off in June at that conference that happens every 2 years, and wrapped it up in June of 2019. And then basically over last summer, developed a platform for sharing and starting to get some feedback from some industry stakeholders, and had the opportunity to present the information at a number of industry meetings, and start to get some quantifiable feedback from producers late in the fall and then in the spring. And then in the spring of 2020, we started talking about a pilot project, okay, which is really based on the feedback that we were getting, seemed to be like maybe the most logical way to move this effort forward of this ASF CSF pilot project that I'm going to talk about here in just a minute. And before I do that, I wanted to for sure thank this group of people, or different groups of folks. First of all, the Swine Health and Information Management Center and the board for funding that study. There was an industry review panel that we brought together last May of 2019. It was held at the Iowa Pork Producers Association office, but it was people from across the country that we brought to kind of review the case study. And that review panel is very important because it was a draft of the case study, and that review panel, we walked through all that and they provided a lot of really great insight about questions and thoughts and how do we refine it. And the feedback from that review was very important of how we finally closed it out then the following month. So I wanted to really thank that group of people. Also, there's been a good core group of collaborators at a number of the Midwestern universities that I show here at the University of Minnesota, South Dakota, and U of I, and a core group of state animal health officials really across those same states have been very important as we've looked to put together this proposal that we're going to talk about. USDA swine staff for helping kind of bring this thing forward here. Which really started to come together, this pilot project, or the proposal for it, in March. And then members of the National Swine Disease Council, a lot of folks along the way. And also wanted to recognize Dr. Mike Lemon and Rexanne Struve and their group really at the SPF system, who helped put together a generous gift of funds to help move this along as well. And so what I'm going to talk about next is this project that we're going to start in. We just found out here probably a couple of weeks ago that it was for sure a go, and it's going to get kicked off here the 1st of August, a 2-year project funded by the USDA Veterinary Services, and it's a project entitled "The Development and Demonstration of a U.S. Swine Health Improvement Plan, modeled after the National Poultry Improvement Plan." So it's with this group of collaborators, again representing kind of these same Midwestern institutions, the University of Minnesota, South Dakota, Illinois, and folks here at Iowa State. And truly, the pilot project's about an industry, state, and federal partnership, and really centered on this objective, establishing an ASF CSF monitored certification program that is modeled after the basic tenets of the National Poultry Improvement Plan's avian influenza H5H7 monitored certification of U.S. commercial poultry operations. And upon the conclusion of this ASF CSF monitored pilot project, the experiences gained and operations established would have the opportunity to be transitioned into a more formal and ongoing platform for safeguarding, certifying, and bettering the health of U.S. swine and longer-term competitiveness of the U.S. pork industry. And so just a little bit about the project and the funding and so on that's behind it. So again, it's a two-year pilot project funded by the USDA at the tune of about $500,000. And that's really focused on what I would say the central administration and development and central administration and of the project really focused on the human resources management systems and outreach that are necessary to really to facilitate the development, initiation, and central coordination of the project. Again, folks from across these different universities all involved, and then support also in kind from USDA swine staff, official state agencies. So the states that choose to participate in the pilot will be responsible for funding the operations within their state. Okay, and that would be expected to be through a combination of potentially some industry grants, participant fees, and potentially some funding from the respective state Department of Agriculture. The participants would be producers and packers, and the producers and packers would be responsible for essentially the costs associated for participation in meeting the requirements of the certification, which are really founded on these three main areas of traceability, sanitary standards, and disease surveillance. And so I'm going to go into now a little bit about NPIP and what is NPIP. So it stands for the National Poultry Improvement Plan. NPIP is a cooperative industry, state, and federal program that serves to safeguard, certify, and represent the health of U.S. poultry. It's implemented across all segments of the U.S. poultry and egg industries, and participation in NPIP is essentially, it's of course voluntary and essentially universal across all commercial level type operations. The NPIP health status classifications, they're the officially recognized standards of health across the U.S. poultry industry, and they're used to demonstrate freedom of both trade and non-trade impacting diseases. So what does NPIP do? They approve diagnostic test methods. They determine the requirements for a specified NPIP health status classification. They certify diagnostic laboratories, and they maintain and verify the status of their participants for the certifications in which the various participants choose to hold, and they maintain a list of that on their website. And so how do participants use NPIP? Well, they use them to certify the health status of U.S. poultry and egg flocks and hatcheries, products, meaning chicks and eggs, the supply chains to slaughter plants, and various industry segments, or what basically segments of the U.S. poultry industry, what they call subparts within a given state, and states, really in accordance with the NPIP standards and definitions. And although participation in NPIP is voluntary, specific certifications can commonly be required at a point of sale, exhibition, and or for interstate or international commerce. And so with this, I'm going to spend a little time on this slide. This slide is really the authors of this the authors of this case studies was our effort to how do we most succinctly summarize what NPIP is that is really well understood across in the U.S. poultry industries and by and large across all 50 states amongst the USDA and state veterinary medical officials, but not really well understood probably outside of the sphere of the poultry industry and the associated state and federal VMOs. But I would summarize it most succinctly by saying it's a true working, active industry, state, and federal partnership that functions in alignment with this wheel that I'm depicting. And it starts with this group up here. That is a Congress of industry stakeholders and subject matter experts that convenes every 2 years. That was the meeting that we had the opportunity to go to in 2018 that they call their biannual conference. Okay, and essentially this is a formal Congress that comes together to define and continually update the program. The USDA Veterinary Services plays the role of facilitating the program which the core role of that is to ensure that the program documents are being managed and kept current, such that they can be current with the amendments that are being made to the program every 2 years. And the official state agencies, they essentially adopt and administer the program to meet the needs of the U.S. or of the poultry and egg industries within their respective state. And producers and packers, which are the participants, they implement the program in accordance with the certifications that they choose to hold. And I think if you look at this wheel, a lot of times you'll see things around continuous improvement. This wheel represents, I think, very much in alignment with that model. But I can't overemphasize enough about how important this group is in the upper right-hand corner, because that is essentially the group that drives the program over time. And so again, this group gets together every 2 years, and this program has been around a long time. Actually, and I'll get into that in a minute, it was actually started back in the 1930s. And so for such a program that's been around a long time, it's a very active program. As an example, the meeting we went to in 2018, there was just 42 proposals that were brought forth for consideration or amendments. 36 passed, 6 failed. And they said that number in that 35 to 45 amendments is pretty common. And so why does NPIP work? I think kind of our assessment over the course of the study was that it leverages the breadth of industry participant know-how in defining and maybe what I would consider more directly addressing poultry health items of significance and relevance over time. There's a critical mass of participation, as I mentioned earlier, essentially universal amongst commercial operations, and it provides clear and uniform standards that are recognized and practiced across all 50 states, and carries with it a significant international recognition due to its USDA-associated affiliation and certification. Like I mentioned, NPIP has been around a long time, started back in the 30s, 1935, to eliminate pullorum from breeding poultry, and has since continued to expand to other pathogens and certifications and so on up to current day. But its core, and even today, and dating back to its origins, have been around certifying breeding poultry as being free of specified vertically transmitted diseases, meaning diseases that can be passed basically from the hen through the egg to the chick. And so here's a list of the various NPIP certifications for breeding poultry. Again, a number of these for different pathogens and statuses. But the definitions vary by what they call subpart, okay? So for specific, there can be some variability in what it means to be considered this AI clean, and does it apply to all or not? And again, that's for each basically different type of breeding poultry. Okay? But today, there's only one, which is the first and currently the only NPIP classification that applies to commercial poultry. Okay, and although NPIP has been around a long time for breeding poultry, the commercial poultry was really just brought into it in 2006. Okay, and it's called this H5H7 Avian Influenza Monitored Certification. Okay, and this certification is held by the essentially the folks that sell the product into the marketplace. So in the poultry world, it's held by the meat type chicken slaughter plants, the meat type turkey slaughter plants, and the table egg laying flocks, as those are the primary entities selling product into the marketplace. Okay? So again, the H5H7 AI, or avian influenza monitored status of commercial poultry, held by the slaughter plants and table egg flocks, as those are the entities selling the product into the marketplace. The system provides a system for ongoing disease surveillance, a mechanism for advancing biosecurity practices that mitigate disease spread into and between farms, provides a system, an ongoing system for demonstration of freedom of disease that are in operations that are outside of affected states or regions that are affected by an avian influenza event of significance, whether that be high or low path. And it's played an absolutely essential role in helping sustain export markets and ongoing interstate commerce in unaffected states and regions and outside of trade impacting disease control areas during any such avian influenza event of significance. So it's a proven and a working platform. I would say this back here, back to how this thing got started, to pull the whole commercial poultry industry into it, because that was a really significant event that happened. And that was a really significant event that happened, and it was driven by some market disruption that occurred due to some low path AI activity that happened in '02 and then into '04 into the basically the Shenandoah in North Carolina, Shenandoah Valley in Virginia, then down into North Carolina, and then a high path event that was smaller in scale in Texas in '04. And those are really, and plus with a growing amount of poultry being exported, those were really the key things that drove the expanse and implementation of this H5H7 AI program in 2006. So a proven system and working platform to more directly and systematically address major animal health issues or major animal health challenges that really extend beyond the immediate influence of an individual producer's or packer's farm gate. And if you're interested at all, again, US Swine Health Improvement Plan.com, and gives you various ways to digest the study if you're at all interested. And so that study is what led us to this proposed pilot project that I mentioned earlier. And again, the objective of that is to develop and implement a pilot ASF CSF monitored certification program that's really just modeled after the basic tenets of the NPIP's H5H7 avian influenza monitored certification of the commercial poultry operations. Its purpose is fairly straightforward. It's to enhance foreign animal disease, specifically ASF and CSF preparedness, and really all three phases from prevention, response, and recovery, as well as having the ability, the potential for impacting, reducing the impact of recurring endemic diseases of high consequence through the advancement of sanitary standards that mitigate disease spread into and between farms. And I think the last one there is maybe as significant as any of these is to provide the U.S. pork industry a firsthand experience in developing and implementing an NPIP program, i.e. the U.S. Swine Health Improvement Plan. Participants, who would participate? The participation would be voluntary. The participants would be interested producers, packers, states, and the USDA. People that choose to participate and meet the specified requirements of the certification. The certificate holders would be producers and packing plants. The requirements for certification would be fairly straightforward and founded kind of on the core things listed here. First of all, that the participants are enrolled in meeting the requirements of certification. They carry a valid VCPR with an accredited veterinarian, and their meeting and the requirements are going to be around these core things of sanitary standards related to the food supply, things on farm, live haul, how pigs get to slaughter, traceability standards associated with demographic, having current demographic information that's complete and precisely correct, and having the ability to upload swine movement information electronically on an as-needed basis, and surveillance testing based on a state-of-the-art sampling regimens and diagnostic tools that are based upon and clearly defined by farm type, and that would vary by farm type and the ASF and CSF status of the country. Basically, the system of governance for the pilot project, essentially all we're doing is mimicking the NPIP's system of governance, with the only exception that because of its pilot project in nature, the program investigators meaning the folks from the various universities put the proposal together, are really going to be playing the role of the administration to help facilitate the project, maintain the documents, and provide summary level reporting. We're going to have a general conference committee, which is essentially an industry advisory board with representation from the various segments of the U.S. pork industry. And our hope and thought with that is we would seek synergies and representation really directly with the membership of the National Swine Disease Council for that effort. There'd be various technical advisory committees, and these folks would be around. They would really be the folks on these committees would really be around the ones tasked with initiating the drafting the proposed program standards for consideration. Again, around these three basic topics of sanitary standards, surveillance and diagnostics, and traceability. And then there'd be a House of Delegates that would come together, and essentially that's akin to the biennial Congress that I mentioned earlier. That is really the decision-making body that determines, what goes into the program and what doesn't, in the direction of it going forward. And we'd be looking for representation from all the states that have an interest in participating, and that their voting rights, so to speak, would be proportional to the size of the U.S. The size of the pork industry in their respective state, and be inclusive of their state animal health official or their state animal health official's designee as a voting member. The pilot project, again, just as it relates to administration of it at a state level, there would be a that's where the certifying agency would be, which we would consider this pilot program official state agency. That very similar, if not the same as NPIP. They would be tasked with administering the program within their state, maintaining a list of the participants and participant level information, and then be responsible for verifying the participant status on an as determined or as needed basis. The participants' responsibilities would be to enroll and to meet or exceed the requirements for certification, and then the ability to verify compliance on an as needed basis. And again, so kind of in short, essentially what we're trying to do here is just take this pilot project and model it really after a long-standing program and system, and more specifically after the basic tenets of the NPIP's H5H7 avian influenza monitored certification of commercial poultry operations. So we're looking forward to getting this pilot project off the ground here in the months ahead. We have a fairly aggressive timeline, and I think the folks involved in it are optimistic that we think it could be a really great opportunity to help further a lot of the work that's been going on in this area and take another step forward. Kind of a proposed roadmap of where we think this is going to go anyway, to the best of our ability, is getting it kicked off in August, really with the core first items on the agenda is establishing this advisory committee, or this what we call general conference committee. Again, and we would be looking for as much synergies and representation with the National Swine Disease Council as much as possible there. We'd be looking to onboard basically the folks that would be facilitate or tasked, whose positions and jobs would be to coordinate the program on a day-to-day basis. And that would, as for the coordination of the program, was so a project coordinator and then a veterinary system support specialist, which is more around the information side of it, and to begin sharing the statement of work and soliciting, the statement of work about this pilot project, what it is, how it works, and get some feedback from the veterinarians and producers and packers and state animal health officials, essentially starting to raise awareness. And then we would be looking to solicit industry participant to determine who may be interested, meaning producers, packers, and states that would be interested to participate in the process of formulating the pilot project program standards through the aforementioned pilot program system of governance. So basically, it's like who would be interested in having their to participate in the process of deriving the standards for consideration or for deriving the standards of the program, and then we'd be soliciting and appointing technical advisory committees that would be tasked with drafting the initial program standards, again, centered on these core things of sanitary standards, surveillance and diagnostics, traceability, and then with any such program, it's important that terminology matters, and so having ensured that we have a glossary of terms that's well understood for the language that's included in the program. And then looking at into the fall, would be drafting the technical advisory committees would be drafting the standards, getting input from the states that choose to participate to determine how they're going to choose the delegates to represent their state in the House of the Delegates, and then distribute the ASF the drafted documents to the states that have an interest in participating in the House of Delegates, and then bring a group together for this pilot project, House of Delegates, to really determine what goes in the program, its direction, and most specifically, what are the requirements for certification by a majority vote, and then would be looking to finalize that on the heels of the meeting to get the program documentation together based on the outcome of the House of Delegates, and then looking to basically roll this thing out in the first of the year, basically first quarter of 2021, with signing up for the states that choose to participate for getting their official state agencies off the ground and getting this thing started with people signing up and getting certified, and then basically let it run over the course of just a bit more than a year, and then start to get some feedback from participants, of course, over that period of time, and then decide what is the feedback and vibe by a survey of the program participants about to assess interest level in in areas for improvement, and then really to say do they want to see this either potentially continue and or be extended by another 12 months, and if there's some level of interest to continue in some way, the idea would then bring to reconvene the House of Delegates to say, okay, what are some proposed updates to this program, and then maybe making a more official vote about is it something that they want to move forward into something that's a more formalized, ongoing organization and effort going forward. So that's kind of the proposed roadmap of where we're at a high level. Our friend over here, or enemy maybe, is this a lot of probably the biggest questions I think on that. It's a pretty aggressive timeline. There's a lot of unknowns, especially I think because of the current scenario we're living in with the COVID-19 stuff. And so going back to my title, or the title of this talk, I've kind of have mixed feelings about this, is that about the case study and doing that work and then getting feedback from producers and veterinarians and some folks from the packing side too. I've been really involved in that for the last basically 2 years, starting with that study that we in earnest in 2018, and so this thing's starting to come together now. It looks like there's some interest, and USDA is getting behind it, and so on too, and my mixed feelings a little bit on it are, COVID-19 has and continues to cause, some much extraordinary hardship across our country, the U.S. pork industry and world, and so perhaps such hardships are, and the very real and substantial industry and societal level stressors in play, make the timing of this pilot project, potentially far less than optimal. And as I've thought about that more and more, and kind of through some of the experiences we've been going on through locally that I shared early on in this presentation, I think from that it might suggest that, maybe there would be no better time than the current to get this thing going. So with that, we're excited to get this thing kicked off the ground, give this model a whirl, get it out there, and get this concept introduced to U.S. pork industry stakeholders, and excited about it, getting this pilot project off the ground and see who may be interested in contributing to the derivation of the requirements and being representative of that House of Delegates that we plan to convene in December of 2019.